what they have to do. We've spent so much time telling people what they're supposed to do. We have kind of forgotten to tell them when they don't have to do certain things, and had a conversation a couple of weeks ago around temperature checks and the idea that that was a really big deal in the beginning, but was never really actually mandated. It was an extra go-to. We've got rapid antigen tests floating around, which is great, but nobody's required to do that. So I'm going to turn it over to Roberto and Andrew. And well, thank you, Suzanne and Leslie, for joining us, and anybody from those chambers that have come along. Really happy to have you here with us today. Suzanne, any words?
I think I'd just start by saying, welcome to Roberto and Andrew. We're very fortunate in our region that we have such a great connection to our health unit. I know that Jill and Leslie and I feel ourselves very fortunate that we can ask those questions. You're supportive of what we're trying to do, because I know that's not necessarily the case in every region. So I just want to start by thanking you for coming back and doing this once again. I think, Jill, you said this is the 4th time now that they have done this live Q&A, and I know that it helps so many businesses. So thank you for taking time out of your busy schedules to join us.
Well, thank you for having us. It's always a pleasure for Andrew and I and myself to come back. We like to be sort of put on a hot seat and answer the questions that may be out there, and it makes us better, I think, in the end when we leave here. Andrew and I often have a discussion about things that we can improve upon. So we appreciate the opportunity to be here to talk to yourself and the membership.
Sounds good. I'll just check it. Oh, good. I just want to make sure that everyone can hear me.
We can hear you.
You're good. You're good. You're good.
Oh, yeah, a very fancy place you got.
Oh, good.
Anything from you?
Pleasantries aside, do you want us to start with a quick overview of the current situation in Hastings, Prince Edward?
Sure. And if you don't, and so for anybody who would like to put questions in the Q&A, that's a great spot to do it, because then if you see a question that someone's asked that you like, you can upvote it. So you don't have to type as much. So please, to all our participants, feel free to add those and we'll capture them. We had a few to start with, but the overview is always great. Thank you. Okay. We'll leave it with you.
So internally now we're doing weekly updates to the staff. During wave 2 and 3, we were getting these updates daily because things were much more, were different at the time. So the latest update Andrew and I have is from August 10th, which I think is 2 days ago. And currently we have 24 active cases of COVID-19 in Hastings, Prince Edward Public Health. That is a 7-day rolling case average of 13.7 out of 100,000 population. So if you think back to what seems aeons ago, to the color-coded framework that the province was using last year, that would put us sort of in the yellow zone. So case rates were much lower throughout the summer, June, July, but things case numbers are starting to uptick now. The positivity rate for a 7-day average is 1.2%. So out of 100 people tested, 1.2 are positive. In terms of vaccination, right now we have 122,562 people vaccinated, or residents of Hastings, Prince Edward County vaccinated. So that's with 1 dose, I should mention. So that's 82% of the total population. As you may recall from previous chats, our catchment area is 160,000 according to the census. Individuals 12 and over with 2 doses is 101,500. So that's 68% of the total population in Hastings, Prince Edward. We have 2 current ongoing outbreaks. One was just declared 2 days ago, related to a manufacturing facility where there was 4 cases associated with that facility. And then we have another ongoing outbreak related to a social gathering celebration. I think that's all I have. Anything you wanted to add, Andrew?
Could just have a small comment perhaps about cases of COVID and related to vaccination status. I can't quite remember the numbers, but I think it was something like, so we've got close to 1,200 cases in Hastings, Prince Edward Public Health Region. And I believe somewhere around 1,100 of those 1,200 cases were in people that were unvaccinated. I don't have the data right in front of me, but it's strong evidence that, as we suspect going forward, that its cases are going to mainly be in the unvaccinated. So just a plug there for getting vaccination.
Yes, thank you for that. And I made a note that provincially as well, Ontario on August 10th reported 321 cases, and 83% of those were non-vaccinated individuals. And this is important because we are, I believe, in the cusp, so to speak, to go from step 3 reopening to exiting the roadmap. We don't have any concrete data or information to share with you today, except for the fact that Dr. Moore, in his daily pressers and the media reports coming out of those pressers, is indicating that 7 to 10 days we could possibly be moving on to the next stage. Okay.
Roberto, I have a question for you then, on the subject of vaccines and vaccine rates. I know in order for us to get out of step 3 and go post roadmap, there needs to be 80% first vaccines, people over 12, and then it needs to be 75% average across the province for second vaccines, with no one health unit having less than 70. Do you predict that our health region will have any problems getting over that 70% threshold that's being mandated by the province before we can, before the whole province can go into post roadmap?
Well, I think the number I cited earlier was 68%. So we're, and this data is a couple days old. We are still holding vaccine clinics, although those have slowed down substantially. And our hope is that within the 7 to 10 day period that Dr. Morris talked about, that we're one of those health units that is 70%.
Yeah, we expect there'll probably be a bit of a surge, going back to school and, a few little peaks that we're getting right now in terms of cases. And since we're quite close to the 70%, we're certainly optimistic that we will at least get that, but it definitely is stalled.
So the question about all health units being at 70%, is there any location? Is that kind of a hard and fast that unless everybody's there, we won't be able to move out of this? Or are they going to move into a regional thing again? Any idea?
That remains to be seen. It's a great question. That remains to be seen. I think from what we can tell, the desire of the province is to move everybody to the next stage. But when you listen to Dr. Moore talk about moving to the next stage, there has been a suggestion that there might be a regional approach. But mind you, that was more to do with the school reopening, where he said in some jurisdictions, for example, the masking requirement may be lifted depending if the conditions were correct. So I think the intent of the province is to move the entire province to the exit stage, or stage 4, if you want to call it that.
Mm-hmm. And are there any health regions that are really at risk then of holding us back? We'll go talk to them.
I'm not aware what the rates are for the other health regions. Andrew and I are so, I guess, concerned with Hastings Prince Edward that we haven't really been, unless Andrew knows whether there's any trouble spots across the province.
Unfortunately, I'm the same. I haven't looked and checked on the status of the other health units.
Well, we can look that up and send it to you if you wish.
I think too, we should be heartened by the fact that for first doses in our region, we're over 80%, which means that it could just be a timing thing for people to get those second doses. As they, we were one of the areas that were had some of our vaccine reallocated to some of the hot spots. So some of our residents were delayed in getting those first shots because there just wasn't enough appointments available. And the fact that we're over 80% on those first shots would lead me to believe that most of those people are going to get those second shots once they've passed that 28-day threshold. Does that sound reasonable, Andrew and Roberto, to make that assumption?
I believe so, and I think it's demonstrated as well by the fact that we have started doing more and more drop-in clinics so that people can come at their convenience as opposed to booking appointments. And when we started doing those maybe 3-4 weeks ago, there was a high level of interest, especially within the first 3 or 4 hours of the clinic opening, but then they would tail off during the day. So I would concur with what you're saying.
Do you have a good list of who's doing those right now? Like I mean, sometimes it's word of mouth. Like I heard, oh, so-and-so got their vaccine at such and such a pharmacy. You can walk in. And that's how I got my second one. So do we have kind of a updated list that has that?
We do frequent announcements on our social media platforms, mostly Facebook and Twitter, as to where things are being offered, and our website as well.
Okay, we'll take a quick look and maybe pass that on to everyone. I know that we are looking forward to having a bit of a vaccine clinic at the Midway when they come to town. So I believe that second weekend, the 27th, 28th, 29th of August, we'll have right down there at Westwick's Park in the tennis court. So that's exciting news. So hopefully people, as they go to get on the rides, they'll just get a jab.
I think too, before we maybe, while we're on the topic of vaccines, there is a question in the Q&A about mandating, can a business mandate their staff to be vaccinated? And I know this is a bit of a hot topic across the province with many different organizations calling for teachers and healthcare professionals to be mandatory vaccinations. What is your take on that right now from a business point of view? Can businesses mandate that? And do you have any suggestions on how they could go about encouraging their employees to get vaccinated?
So those questions have been coming in more frequently now in the last 3-4 weeks from businesses. So the general consensus after we check with our legal counsel is that on the employee side, those appear to be lawful, but we strongly recommend that a business check with their own legal counsel because there may be some unique circumstances or to that business that we're not aware of and we can't provide legal advice in the first place. So they appear to be lawful, provided that the Human Rights Code is not infringed upon. If someone medically can't take the vaccine, then that sort of thing has to be dealt with in a non-punitive way. Similarly, with the public, some business have been asking whether they can have a no sort of vaccine policy. And similarly to months ago when we talked about requiring people to have a mask on and also not serving those outside of our catchment area, though these policies appear to be legal, again, subject to the Human Rights Code to make sure that no one's rights are being infringed upon. But the takeaway for that is to check with your legal counsel, or if you belong to an association that has can provide a legal opinion of that, is to consult with them. Andrew?
Well, I can just comment from a personal experience at the health unit. It will be a requirement for all our staff to be vaccinated against COVID. Again, with if they have a medical exemption. So we've taken that stand, certainly in our office.
Do you feel that under the current regulations, because we're currently in step 3, should employers be treating fully vaccinated differently than partially vaccinated or unvaccinated employees?
In what way? Sorry.
I guess, you know, I know that there's certain, some of the rules are still in place under step 3, such as, you know, you have to wear masks inside your workplace unless you can physically distance from other people. There's certainly this daily screening that is being, that is still required. I know businesses still have to have that safety plan in place. So I guess I'm just asking, you know, do you see any reason why employers should be treating vaccinated staff, fully vaccinated staff, any differently than unvaccinated staff?
So I think the quick answer to that is the regulations right now don't distinguish between vaccinated and unvaccinated staff. And when I say the regulations, there's 2 sets of regulations. There's the Reopening Act regulations, which we talk about step 1, 2, and 3. And then there's the Occupational Health and Safety Act, which a lot of this COVID material or stuff falls under section 25, the reasonable care of the employer to protect the health and safety of the employers. Right now, there's no distinction between staff who are vaccinated and non-vaccinated. Whatever rules apply to both. Coming in today, though, one of the staff downstairs started asking me about the changes that were announced yesterday by the government in terms of case management and how vaccinated people and non-vaccinated people will be treated if they're deemed a high-risk contact. So there is a change there, and that might emphasize the need to be more scrupulous around personal protective equipment for all staff, meaning that if there's a case that happens in a business, either customer or staff, and there's contacts of that person, wearing PPE might help you in terms of whether you have to isolate or not.
And one thing we talked a little bit about the idea that there are things that have changed. A question we got in advance was the active screening process. Is there any anticipation that will stop at some point? Because I noticed there is that last new question from July that if you've come in contact, but you've been vaccinated, you can still answer no to that question and enter the workplace.
Yes, I think one of the things I've noticed personally, and I think others have as well, working in public health, is that the stage 4 regulations, the exit regulations that will come into effect shortly, 7 to 10 days or 7 to 14 days, really reduce the requirements for businesses and organizations. So I think when you read Schedule 3 and 4, which kind of encompasses everything that's required in the exit stage, there's I don't think there's a requirement for active screening. There's passive screening requirements, posting of signs at the entranceway, and just other general requirements like masking, distancing, having a safety plan, and also posting the actual occupancy. But again, with occupancy in stage 4, there is no set occupancy determined by the regulations. So right now there is for certain, for nightclubs, for example, it's 25% of the fire code. For banquet halls, it's 50% occupancy. That's all going to be taken away. And we're sort of back to normal, to the way things were prior to COVID. It will be largely determined by your fire rating, your fire code occupancy.
So really 2 weeks, we're looking at kind of that much normal.
Yes, which I think a lot of people welcome, and I think some people might feel anxious about it.
No, that's really exciting.
We do have a few more questions on vaccination. So maybe we could, I don't know if Jill and Leslie want to help run through some of those questions in the Q&A around vaccinations, and then we could maybe move on to some of those more questions around regulations and things like that.
I do see this one question about common reason for not vaccinating, and I would actually invite anybody who's participating in this call, if you have employees who are resistant or reluctant to get vaccinated, put that in the chat. Then we all know, because I've heard a variety of reasons. Some people are truly anti-vaxxers. Others are, it's a timing issue. It's a convenience issue. They're worried that they're not going to feel well and they don't have time to take off work. So, I mean, please feel free to throw that in the chat, because we can all benefit from kind of understanding maybe where that resistance is coming from or where that extra bits are. Anyway, so I'll leave that out there, and then maybe we can move on to another question.
Unless they have an answer for it themselves, like what is the number one reason that you guys are hearing from people?
I'm not sure there is one reason. Everyone seems to have their own individual reasons for resisting or delaying getting the vaccination shot. I mean, I know I've spoken to people that they just don't trust the science. They feel, you know, I want to wait 10 years to see that there's no adverse effects from the vaccine. And that's hard to counter. That's hard to answer that question. But unique reasons, as unique as the people are, I would say.
So one of the other questions in the Q&A was, should someone who is not vaccinated be allowed to provide direct client service?
Again, there's nothing in the regulations saying that that person can. What we would emphasize is that they follow the regulations in terms of specific personal protective equipment, depending on what type of service they're providing and whether the client is masked or not.
And I guess the other side of that is there's a question about maybe people that are vaccinated or people that are providing direct client care, treating unvaccinated clients in healthcare. What are the current precautions they should be taking? They've got here goggles, mask, gloves. Don't know if you have some answers to that.
Sorry.
Yeah. Well, go ahead, Roberto.
No, go ahead.
Well, I was just going to say that you know, the healthcare workers, they're going to be required when dealing with someone that's unmasked and they're providing some sort of care and they're within the 2 meters, they're going to be wearing surgical mask and a face shield most likely. So that's not going to change. I can't quite remember all the questions, sorry.
And that was it. Just, yeah, just, you know, what precautions should they be, should direct care providers be wearing when they're dealing with unvaccinated clients?
I mean, in terms of the situation, there is no black and white. Like vaccinated people, there's still breakthrough infections, but they're the exception to the rule. The numbers are very small. And when someone who's doubly vaccinated does contract COVID, the illness is not as severe. So when I look at things, you know, if you're dealing with someone who's vaccinated versus not vaccinated, if you yourself are vaccinated, then you're protected to the best that you can be protected. It's like having that seatbelt on or having a car that has extra airbags. Whereas the person who's not vaccinated is really the one who's taking the risk of catching the illness and contracting the virus and developing severe illness, resulting in hospitalization and potentially intubation. When it comes to getting over resistance, I think from what I've read, it's about repeating facts to people that are resistant, you know, trying to be not judgmental, same way that we treat people who choose to not breastfeed, for example. So just repeat the facts of the science that, you know, this mRNA technology may seem new, but it was being researched for 10, 15 years ago. Millions of people across the world have been vaccinated. There's been some instances of adverse effects, but those are very small and less severe than actually contracting the virus and ending up in the hospital.
And that does kind of lead to, there's another question around this too. If people who are not vaccinated are at greatest risk, wouldn't it stand to reason that the vaccines should be optional?
Should be optional or mandatory?
Yeah, they're saying this. They're saying if people who are not vaccinated are at the greatest risk, wouldn't it stand to reason that vaccines should be optional if they're the ones, if they're putting only themselves in danger?
Well, they're putting themselves in dangers of severe illness, but they're also likely to spread it to others. And on the former, you know, if they the severe illness could result in hospitalization and overburden of the healthcare system, which could lead us to potentially more broad-based restrictions and lockdowns that nobody wants at this point, myself included.
I think that's the point, is that we have to get to this percentage of vaccines so that even if people who choose not to get vaccines get sick, our healthcare system won't be overburdened.
Mhm.
And that's the rationale behind this percentage, if I understand correctly. So,
We have a
so
question.
yeah, go ahead.
Go ahead, Jill.
No, go ahead. Unless
Actually-
Leslie has a question, maybe.
Yeah. There is one in here about children that are too young, under 12, to be vaccinated. Are there any updates on when those under 12 can be vaccinated to further protect households? Are you hearing anything about that?
I haven't.
Last I heard,
Andrew?
last I heard was they're in the trial stage. They are working on it, so progress is being made, but yeah, I haven't heard any timeframes yet of when they'll have that available, or if.
Okay. And there's actually more questions about vaccines, but I wonder if we should maybe, because we're halfway through, and I mean, I know vaccines is the big hot topic right now, but maybe we should move on to some of the regulation questions, and then we can always come back to the rest of these vaccine questions at the end. Does that sound good, Jill and Leslie?
Yeah, for sure. Let's hear what we can and can't do.
So I have 4 questions that were pre-submitted. One of them was asking about private outdoor office functions conducted on property owned by the business. Are they subject to the same rules as those for rental functions?
Did you want to take this one, Andrew?
Sure, we'll go back and forth, I guess. Okay. Yeah, if it's truly a private function, no, it's not subject to the regulations. But if public is involved in it, then whatever regulatory rules are there are applicable.
So the gathering rules, I know that there's like right now we've got, we're allowed to have 25 people gathered indoors and up to 100 outdoors. So would those be the limits that they would be able to have their event under?
Roberto?
Well, those limits would not apply to a business who's operating normally, or if it's having a training day. So unless the public is invited, let's say they're having a customer appreciation day or a barbecue of that sort, then those limits might be triggered, most likely be triggered. But if they're having an entirely social, a private workplace function, those limits do not apply. That's, however, screening of staff to make sure that there's no ill staff attending. Distancing, masking if people are going in and out of the building, that sort of thing still apply, but not the gathering limits.
Okay, well, that's good. So then another one was around mask wearing, and I know from what I've read about post roadmap, mask wearing is going to be with us for some time. And this question comes from one of our retailers. What is the rule around mask wearing? If a customer says that they cannot wear a mask, are they allowed inside a business?
So the regulations require masks. However, there's exemptions provided. One is for medical reasons. So if a customer has a medical exemption, they can be allowed into the premise under the regulations. That said, the premise could have a stronger organizational policy, either originating at the business itself, the location, or through head office if it's a chain, at which time the customer should then be dealt with in alternative methods to ensure that we're not infringing on their human rights code if they have a medical condition. So curbside pickup, for example, ordering ahead, that sort of thing. So that's what the regulations currently state under stage 3, and that's going to remain in stage 4.
And I know, going back to like the early days of the pandemic, which seems like so long ago, there was a lot of conversation and advice being given to businesses on how to ask those questions. So if, even though masks are mandated, if they, so long as they remind their client that they're supposed to wear a mask, and if they come back and say they have an exemption, the business has met the requirement for requiring a mask upon entry. They don't need to ask for proof of an exemption or ask the person what the medical issue is. Does that still stand?
Correct.
Yes, it does.
Okay, and then I have another question then is, I am inquiring on what the restrictions are in regards to hotel breakfasts. We used to have a self-serve buffet prior to the pandemic. With restaurants open, I wanted to know if we are able to go back to our regular breakfast or what modifications we need to make in order to comply with the current rules. And that's from one of our local hotels.
Yep, they're back in business in terms of the buffets and the food service there. We would just, request that they, have one flow direction and any other steps that they would take to minimize contact between people and keep things clean. So, but yeah, they can get back to food service there.
That's big news. That's excellent.
And then the last pre-question that I had was, it says that the government of Canada has distributed information to help guide decision-making around the use of masks following vaccinations. My question is twofold. Does Hastings Prince Edward Public Health endorse this? And is it relevant to businesses? Are masks still required in the workplace if the workplace is small, 10 people, and all staff have been doubly vaccinated more than 14 days ago?
So
Yeah.
go ahead, Andrew. Sorry.
Yeah, I looked at that document. We had a similar version distributed earlier. I think it came from Public Health Ontario. So, it's just a general guidance, and are masks still required? We already talked about that. Yes, they are in, if you can't maintain 2 meter separation. So in a workplace, if you can maintain 2 meters of separation and the public's not accessible to it, you don't require masks. I'm trying to think that
So the masking
really matter on the
regulations
spot.
still apply. Is that right?
Bruno, you got
No, I was just going to concur with you, Andrew. If it's if it's entirely a location within a business where the public doesn't have access to it, and there's 2 or 3 staff working in that area, the regulations state that you don't have to wear a mask. Is it recommended that you wear one? Perhaps, if there's a case in our workplace and we, the health unit or public health, does an investigation to see what was the situation, and if we're now unclear whether distancing was being kept at 100% of the time, that might implicate one of the staff or 2 or possibly more as high-risk contacts, which then have to isolate. But in terms of the regulation itself, the law says that you don't have to if you can keep distancing.
I have just shared that federal guidance document in the chat in case anybody hasn't seen it yet. It is now in the chat there. And those are all the questions I had. So thank you for answering those.
Leslie, do you have any?
I didn't receive any in advance, and any conversations that I've had with business owners, you guys have covered most of those questions, a lot around what you can and can't do in masks and goggles and that for service staff. And then comments I've received, but again, have been addressed here as far as our really young people under 12 who cannot be vaccinated, and where their rights begin and somebody else's rights to not vaccinate or whatever, all of those pieces makes me think of the days when it was smoking in public and not smoking in public and all of the controversial conversations around those rights. And so that's what it's reminiscent of for me and the people that I've been speaking with. Business owners, I mean, and what they were having to do with their spaces and restaurants with smoking rules. So
I think Leslie hit upon something that hits home. In public health, we have this theory, stages of change. Basically, there's 4 changes, starting with a pre-contemplation stage, and that's when someone is engaged in an unhealthy behavior, such as smoking. And it may take a lot of time for that person to get from that stage to stage 2, which is contemplating quitting. So I think that, in my opinion here, I think applies to vaccines. There's a lot of people who are not ready, perhaps, to take the shot, but reminding them that it's the best thing they can do for their health at this point. That's what we tell smokers all the time. You may not be ready to try quitting today, but if you did, it's the best thing you can do for your health. And smokers, when they hear that over and over from their family friends, that gentle jostling, eventually quite a few of them attempt to quit. So I think we could try that with vaccines, is to remind people that, you know, you may not be ready to go for the shot, but it's probably the best thing you can do at this point in time.
One good question that kind of takes us off we've talked about the traveler vaccination and we've talked about vaccination passports a little bit briefly. I mean, ultimately that's going to be the government's decision, and it's probably going to be at the whim of people who want to travel outside of the country and across provinces. So that, I mean, in addition to the family pressure that you've referred to here, Roberto, with regard to smoking, that family pressure around vaccines is probably going to push us over the edge a little bit. And then, of course, personal desire to be able to do things and be permitted to. I think all of that's still underway, and we really know. But there's a question about boosters. So any idea whether or not there will be a booster to this, or have you heard anything from the research?
Roberto's not jumping on. I haven't heard a lot. I have not heard a lot on it outside of, you know, it's a possibility, you know, that you know, time will tell.
And there is a question in the Q&A which kind of goes back to the point we made at the beginning about how some employers are still holding on to some of the old regulations. Because we have somebody asking, you know, while mask wearing may be mandatory in public space, can employers who are satisfied that all employees have been vaccinated relax those requirements to no longer require masks or not require the 6-foot spacing? I believe you answered that earlier, but I think you just want to make it clear that the rules still are in place with the mask wearing, correct?
Yes.
No matter the vaccination status of your employees.
Correct.
Yeah, and one of the few things they're carrying over into step 4 is masking. So that's one of the few requirements that's going to remain. Yours.
And then there was another question, and again, I think you maybe touched on it earlier, but they're just asking again, is what restrictions will remain when we exit the roadmap in 7 to 10 days?
Well, as I mentioned, there's the screening, masking, having a safety plan written out and available to the public if they ask, having the occupancy number on the door, but the occupancy restrictions are lifted. So the fire code, whatever you're approved by your local fire department, will apply. So there's just general preventative measures, nothing specific like Right now, we have rules around no dancing in restaurants. If you allow dancing, then you're a nightclub and you're down to 25%. Right now, we have restrictions on personal care facilities that the client has to make an appointment, that sort of thing. For restaurants, patios, the tables have to be distanced 2 meters unless there's a barrier in between tables. Those are all going to be lifted from the regulations.
Correct. Yeah, it's going to be really, really simplified. And basically, we're going to be down to, as Roberto commented quickly, no capacity limits, no limits on organized events, social gatherings. There won't be a requirement for staff screening, but there'll still be passive screening signage required. There'll still be safety plans required, contact tracing. But it's definitely going to be kind of just those core basic rules, kind of infection control kind of rules, and very few restrictive business requirements.
So there's 3 sectors that will have specific rules. One, for whatever reason, the cannabis stores have their own set of rules in the exit regulations. Schools will fall under the reopening plan, and children's day camps. But otherwise, everybody else will fall under the simplified version that Andrew talked about.
There was a good question here, high risk. Can you define high risk contact? So this is kind of, we were referring to that in the screening piece. Maybe just remind people what a high risk contact is.
So the government has a document called case management protocol that health units have to follow. So whenever there's a lab confirmed case, we, within 24 hours, speak with the case. We call the case and ask, where have you been during your incubation period, which now with the Delta variant is shorter than the original version of the virus. Could be, it was, I think, average 5.5 days previously. I think we're down to 3.5, 4. So we'll get a very long history of where the person's been and who they've been in contact with. Some of those individuals on the list, sometimes it's as many as 3 or 4, sometimes it's 15 or 20. We've had instances where it's 40 or 50. We'll divide that list into 2 categories, low risk and high risk. And the high risk is determined based on the government document, whether that person was in the same room for X amount of time, were they masked, that sort of thing. So the high risk ones will have to self-isolate unless, according to yesterday's announcement, they have they're double vaccinated. So anybody who has no shot or 1 shot will still have to self-isolate. The good news is that the isolation period now is down to 10 days from 14. And, in our experience, when we talk to the cases and then we do another, and what I should mention is we also call the contacts to confirm what the cases told us. And, sometimes people definitely agree that they're high risk. Sometimes they argue that they're low risk. And we've had, conversely, people who are low risk who think they should be high risk. So our staff, it's not an easy job sometimes, but we have to determine what the exposure risk was so that we know how to, what direction to give that person, and whether they should isolate and for how long, and whether they should stay obviously away from work.
And it certainly goes back to that question on the screening, like, have you been asked to self-isolate? And I think sometimes people hear about an outbreak and are concerned that they may have come in contact in some way, shape, or form with someone who might have been a high-risk contact. But I kind of defer to, if you've not heard from the health unit, you are considered a low-risk contact, or you're at no risk. So I mean, I really rely on the fact that your contact tracing has been so successful. And it is actually one of the best parts of our health region, I think, and the work that you guys have done, because it's not possible in regions such as Toronto, the GTA, where they lost control of contact tracing right very, very early on. So I don't think we can minimize the impact you guys have had on preventing spread in our community. So thank you.
Thank you for saying that.
And
I
it's
think
very true. Yeah.
Go ahead,
sorry, go
Andrew.
ahead, Roberto.
I was going to say our
I was just going to comment. I think.
Go ahead.
We don't need both of us, do we? I'm going to say Dr. Moore, Chief Medical Officer of Health, he was reiterating just the other day about that case and contact management has been a big factor. And yeah, locally, I think they've done a stellar job here. They really have kind of nipped things in the bud when they can, and it has made a difference. Roberto?
So I was going to say something similar to that. Our Dr. Oglazer and Dr. Tumishi, we used to have, I think, daily case meetings during the height of wave 3. One of the things that one of them said that stuck with me is that every time a high-risk contact converts to a case, although it's a terrible news for to the person, it highlights the success of case management because that person was under self-isolation at home and didn't expose other people. So, our rate, I don't know what our current rate is in terms of contacting cases and high-risk contacts, but I think it was at 98.5% at one time within 24 hours. So we're doing quite well compared to other areas which were bombarded and with high case counts.
Going back to some of the regulations, there is a question about getting notice, at least 1 week's notice before we head out of step 3. Do you know if that, I'm sure you guys can't guarantee that. I know it's something we would all like. You said you're already hearing Dr. Moore talk about it now, so he's giving people a little bit of a warning, I guess, even if we don't have an exact date. Do you have any thoughts on that notice that will be given?
I would sort of say notice would be wonderful. As it's gone along, we have not received advance notice of regulatory changes or anything like that. In fact, with this step 4 coming, this is the most kind of advanced warning we've had. That we get to see what the document looks like ahead of time, and we've got some basic idea of, time frame of when we're expecting to move there. So an improvement.
And I know this is becoming a big question for a lot of our meeting spaces. I'm sure down in the county, a lot of the wineries and the meeting spaces down there. And I know we have one here in Quinte, a couple in Quinte West that have been asking this question. They rent out their halls for a variety of different reasons. One of them could be weddings or events where they're in a way turning their meeting hall into a restaurant because it's a dining situation. Under the regulations for meeting halls, they're allowed 50% capacity indoors. But restaurants are not limited, but as long as there is some space between tables. Do meeting halls, if they're acting like restaurants, use the restaurant regulations, or do they continue to use those meeting hall regulations?
The answer is a good one. I think in the regulation, it states that a meeting and event space that offers or sells food and drink is automatically a food and drink establishment. So they can then operate similarly to restaurants. And we've had a few questions about that, especially from Legions who are starting to think about opening up. Some of which have already. So if they are offering food and drink, then they automatically fall under the food and drink category. And again, if they're renting out to, and there's a wedding, obviously there's going to be dancing at a wedding, then they have to abide by the 25% capacity, a cap of 250, whichever is lowest. So the answer is yes.
Okay, so if a meeting, I know one particular meeting hall here has got an outdoor space as well, and they're looking at maybe having the dancing outdoors. Does that mean then for the indoor space where there is food and drink, could they still go with that unlimited number of people so long as they can space if the dancing is going to be outdoors and in a different part?
I think the answer is that outdoors, there is a 75% ratio for nightclubs. Indoors, it has to be 25. So if they're offering, now the regulations, we'll have to look at that specific situation on
Okay.
its own. If that particular operator
Okay.
wishes to call our local health inspector, there's 2 in Trenton that divide up the jurisdiction, and we'll provide an answer to that.
Okay. Perfect, thank you.
I have a follow-up question to the booster discussion. Currently, some of the discussion around boosters is for those higher risk or immunodeficient people, but there's also regulations globally in some countries that will not let mixed vaccinated people come in who have had mixed doses, AstraZeneca and then Moderna or Pfizer. So people who need to travel for work and that, can they electively get a booster now that we have all of these walk-in clinics and excess vaccines, so that they have 2 Pfizer or a Moderna Pfizer so that they are able to travel for work to other countries that are limiting that?
That question is way above my pay grade.
Can you pass it up the pipeline and maybe email us an answer for that one?
Yeah, so we can,
Yeah,
Alicia Haynes, our vaccine manager, can weigh in on that. It's not a new question. We get these questions all the time about other vaccines. But it's something that Andrew and I don't know the answer to. And it's a medical question that Alicia, who's a nurse, and our associate medical officer, Dr. Tumashi, can provide an answer to. But we are aware that some countries are not honoring the mixed vaccine, which is, I guess, disappointing a little, I would say, because the evidence shows that there's good protection depending on what the mix is.
Yeah, there's a bunch of comments here on that. But yeah, it would be great if I could get any kind of prescription on how people can move forward with that. I guess as well, the question would be, is the science there for triple vaxxing when you're not at risk anymore greatly? Like, are you putting yourself at risk by adding all of that to your system? Like, there's probably not science for that at this point either. So people just want to travel for work.
Well, the thought around the boosters, the thought around the boosters that eventually the protection provided by the first and second shot will start to wear off and a booster will be required. The research is showing that the first and second shot is given protection, good protection, and it seems to be lasting as long as the manufacturer and the regulators thought it would. So we're not sure whether a third shot called the booster will be required. It probably will be at some point. We're just not sure when. The scenario that you gave us is slightly different, which I don't know how to answer it at this point.
Okay, while I mute myself again, thank you guys very much on behalf of Prince Edward County and for joining us again. And I hope that we don't have to do this again, but I look forward to speaking to you guys in the future. Thanks.
Thank you.
We have one person who has raised their hand. So Sue Stewart, if that was actually because you wanted to ask a question, would you mind quickly posting that in the chat or Q&A? And or maybe you just hit that by accident. And then I think there's one other question about theaters being able to operate at full capacity under step 4, as long as everyone is masked. Is that that's one question.
I don't think there was any specific mention about specific industries. So yeah, they would be, I don't believe they'd have any restrictions outside of masking.
Right. And then one other person asked about face shields. Is that going to be continued? Is that going to continue as a requirement as long as masking is required, especially for personal care services?
When working on an unmasked client, similarly to a server in a restaurant serving 2 diners who are unmasked, then eye protection is required.
Okay. And do we see that ending at some point in time?
I suppose at some point, but it's still in the regulations right now. And
Okay.
it's in the step 3, and it was left in for step 4. So for the
Okay.
foreseeable future.
All right.
Um,
And I just, if I'll throw one more last little thing in there about the idea that if you have vulnerable, and I've heard this from a few of my members who are really adamant about mask wearing regardless of exemption in their workspace or in their retail place or services that they provide to the public, because they have members of their staff that are immunocompromised. So I think what you said before, as long as you state clearly at the door what will be enforced and how you can accommodate someone who wants to enter without a mask, that you can offer curbside or other things that way. So you can refuse in-person service as long as it's consistently applied.
Mhm.
Is that
Correct.
Correct.
So Jill, I just wanted to, I know we're kind of running out of time and we're probably already a little bit on borrowed time here, but there are 2 questions looking for information from the health unit. And one of them is asking if there's any information available for us to share with employees regarding reduction in transmission for those that are vaccinated. Do you guys have any information on that you can send to us and we can share out with our business members?
those stats you provided at the beginning would be great.
Okay, yeah, we can do that. Absolutely.
Yeah, and I think some of that was in a press release that was sent out yesterday from the health unit. And as you know, the 3 chambers here, we are providing free rapid tests to employers to do enhanced screening of their employees. And one of the issues that we've been dealing with is there has been a bit of a decreased demand for these because many employees are now single or double vaccinated. We're trying to also get the word out that that doesn't mean you stop the screening, because they could be asymptomatic because they are double vaccinated. So I just wanted to maybe if you could give your thoughts about employers continuing to use those rapid tests as a way to screen all their employees, whether they're vaccinated or not, to stop them from bringing it into the workplace.
Well, I would say that, staff screening is important still, even though, like you said, we have increasing vaccination rates. The important thing is to keep the people who are ill from those who are not, even if it's a mild case of COVID. So screening according to what the regulations state plus rapid testing is still very important. I would concur with what you said.
I think
I would
that's,
support it too.
yeah. And then I guess that was the other question was around, does the health unit provide some scientific counter arguments to the side effects issues? Again, going back to maybe vaccine hesitancy, about the risk of blood clots with vaccine versus risk of blood clots when catching COVID, or risk of blood clots with other day-to-day consumed products and environments. Do you have something that we could share with employers to help educate those employees that are resistant?
Definitely.
I believe-
Personally, I don't. Go ahead, Andrew. Sorry.
No, I was just going to say, yeah, we can definitely come up with something on that. Roberto?
No, I was going to agree with that. Internally, we have 1 or 2 people who are sort of our science lead, who keep on top of the current science. Andrew and I, get the information from those individuals, but I'm sure they are constantly reviewing the latest data and research when it comes to COVID and vaccination, and we can share something with you.
And we've got one lone question left in the Q&A, so it seems a shame to not quickly deal with it. We haven't really talked about vaccination passports, but this question, I know it's a big debate right now about whether to have them, for domestic use as opposed to for international travel. The question is saying, why are vaccination passports any different to the traveler's immunization record to travel abroad, or a vaccination record to attend school?
So it's a hot topic right now. Quebec has moved ahead with what I think is a sensible plan to keep unvaccinated individuals from certain settings. It's sort of a modified lockdown that impacts more unvaccinated people as opposed to the entire society. The federal government is looking at passports for international travelers. Ontario is right now is of the view that passports are not required, that hopefully vaccination rates will continue to increase to a point where we have herd immunity. But I know the government is under tremendous pressure from business groups, especially the chambers, to perhaps have a second look at that. So although they're saying it's not part of their plans right now, it could be in the future.
You did it. You got through all the questions.
And once again, thank you so much for your time. Roberto's upstairs in the log cabin. Andrew's at home. I've got Suzanne and Leslie. Thank you so much. And to all of you, I mean, we've kept 41 of you here through this conversation. It will be available. We'll post it on our YouTube link and share the link with Suzanne and Leslie as well, so they can share with their membership. And as always, if you ever have any questions, please let us know. We're happy to reach out to Roberto and Andrew. They reach out to us regularly, and I think they're going to forward us a little bit of information that we can pass on as well.
Thank you.
10 to 14 days, like really? Like that sounds pretty exciting.
It does.
Dr.
We're
Moore said
hoping.
7 to 10. I think I stretched it to 14 here, or maybe I shouldn't have, but hopefully it's 7 to 10.
Okay, well, under promise, over deliver.
Thank you so much. Thank you.
Thanks, everyone.
Okay, thanks everyone. Goodbye. Have a great day.